I'm Dr. Soumya Basanth, working as a cornea consultant at Zamindar Microsurgical Eye Centre for the past 7 years. My main area of interest is cornea and its diseases. What are the different contact lenses that we use in our practice? One is the soft contact lens, the second one is the RGP or the rigid gas permeable lenses. These are the most widely used one. Based on the wearing schedule, the soft contact lenses are classified as daily disposable ones, weekly, bi-weekly, monthly disposable, biannually or annually disposable contact lenses are available in the market. Then based on the material that they are made up of, we have hydrogel materials and silicone polymers. The difference is they have a higher decay value, that is diffusion coefficient, that is they permit the oxygen to the cornea, and these higher decay values can have an extended wear also. Based on what they're used for, what is their therapeutic use, they can be used to correct spherical numbers for either farsightedness or nearsightedness, or there are toric contact lenses which are used to correct astigmatism, that is the irregularity of the cornea. And the third classification is they can be used for cosmetic purpose, or they are also called as tinted cosmetic contact lenses, which can be used by a lot of people. We have the other category called the multifocal lenses, where there are two focal lengths where we can use it for distance, intermediate and near vision. Like your progressive glasses, we have multifocal contact lenses also. The second classification of contact lenses are your RGPs. They differ by the diameter. The soft contact lenses are larger in diameter, about 12 millimeters, just rest above your corneal limbus. Whereas your rigid gas permeable lenses are smaller in diameter, they are lesser than the diameter of the cornea, and the material is slightly different. That's why they are termed as rigid gas permeable lenses.